So the Innovation Exchange Leadership is all about looking at different countries and what infrastructure we've got set up to put fabulous research and innovation into practice, and how we spread and sustain that innovation when it's in clinical practice or working with patients to make their lives better. So we've been talking about the infrastructure we have in our countries to do that. In the UK, we've talked about our funding into the National Institute of Health Research, where we fund clinical time and we fund research studies. We've also talked about universities, and our research has to be about, does it make an impact?
Our Department for Health and the Office for Life Science, there were clear that there was a common challenge about adoption of new technology. So we thought good to have the Prime Minister announce an initiative for bringing together those who innovate and have overcome the challenges as well. So a year on, we've had that event, so that's excellent. I'm very happy.
So the highlights for me in the Innovation Leadership Exchange, and I think perhaps for my colleague Mear in Northwest, has been to just notice the journey that we've been on, from loose networking and learning from Denmark to these days being relevant, having something to say, having expertise in some areas for not just Denmark to learn from, but 8 of the 9 Northern European countries, in addition to the UK where we work.
Well, I think this is really showing us that we are all facing the same issues. It's just a question of scale. So clearly, Iceland, with a population of 350,000 people, Estonia, with a population of 1.5 million, have been able to adopt more digitalised health records than we have in the UK, with a population of well over 60 million. But some of the issues they talk about, silos, trust over patient data, things like that, are all exactly the same things that we face here.
There are really interesting things happening in countries like Denmark and Finland in terms of how innovators, public services and the public work together to design innovations, not just to get feedback or tests, but constant involvement from the public in the development of innovation. And we really need to get to some of those secrets.
Innovation Leadership Exchange is extremely valuable because no one can do these things together. We have universal problems, but we hopefully have universal solutions for those. And that's why sharing the policies, sharing the knowledge and sharing the good examples is at most important.
Our ambition in Iceland is to roll out telehealth further than we have today, and even contacted with the social working area also. So we would like to have a more holistic system in telehealth, and that's our plan.
So I think from an NIHR perspective, I guess one of the things that I'm really proud that we focus on is ensuring that there is a mechanism to enable innovators to work with clinicians and with patients and carers to understand what are the areas of unmet clinical need. Because obviously the chances of innovation making it through to a product that is able to be sold and taken up by the NHS is going to be enhanced if it's actually meeting one of the needs of the country and patients.
It's not just me, but others who've enjoyed the networking and found it valuable from the Innovation Leadership Exchange are beginning to think about, plot and plan and discuss doing more specific joint working together for those who are interested, hopefully all 9 countries, but it doesn't have to be, on issues like what is spreading really well and relatively easily in the UK or in Iceland or in Estonia or Finland that all countries could benefit from. Let's hear a bit more about those, share our experience of services like the Precept service that has been taken up really quickly in the UK, and let's see what we can steal with pride or import from other countries.